Hello, I'm back. It's Dr. Mandy. And after 7 months, my baby's now 8 months old of maternity, I am back to doing these podcasts and seeing patients and clients now. So it's been a long journey and I'm happy to be back. And I'm here because I am doing something new. Those of you who know me as the IC healer, which is what I've done for the last several years, I'm starting to get into fertility and primarily because of my own experience with fertility. And I guess the story is, real quick for those listening. As I was working with my IC patients, many of them, as we're fixing their bladders and improving and optimizing their health, they were getting pregnant. And these were people who weren't trying or they just weren't conceiving, but that wasn't on their mind. Their focus was the bladder, and then they were getting pregnant. And so I started looking into that a little more. I'm saying, wow, this method is working. People are conceiving, something I'm doing right. And so I realized that what I was doing was I was improving their mitochondria. And then they were able to get pregnant. And so I think that's a really important topic. And we're going to talk about that because in the fertility world, there's a lot of interest in mitochondria. And we're also seeing that people are going into these things called mitochondrial transfers, where they're, doing some, I call it a little science experiment, where they're taking the nucleus and putting it in another cell, an egg of another younger woman's with the healthier mitochondria. And this is a triple hybrid. And I personally don't agree with it. And I think there's a lot of problems with that. I prefer to optimize your mitochondria, and that's what we're here to talk about. And so this test that I'm doing with fertility is Theriome, and I'm here with Gregory Nacarelli. And is I said it correctly?
Nacarelli.
Nacarelli. Okay. Okay. And he is the clinical advisor at Theriome, and he's going to be talking to us more about this test and why I decided to go in this way. I used to use oat and Nutrival, and for fertility, I decided that this was the one I wanted to use. So we're going to talk about that. Hey, Greg.
How you doing, Manny? Thank you for the introduction. Yeah, as you mentioned, I am the clinical liaison at Theriome. I'm a naturopathic doctor by training, and I also have a PhD in genetics. And I focused my research career on looking at nutrigenomics and different metabolites associated with cardiovascular disease and cardiometabolic dysfunction. And I would say my clinical focus has been multiomics. So my goal is to really see how we could combine different omics technologies, the metabolome, the microbiome, the genome, the epigenome, into clinical practice for beneficial health outcomes.
Multigenomics. Can you explain what that is real quick?
Yeah, multi-omics. So the ome as the suffix basically means entire collection of. So when we look at the genome, it's the entire collection of genes. When we look at the metabolome, it's the entire collection of metabolites. The microbiome is the entire collection of microbes. And so essentially those are facets of science that is looking at, okay, how are these things impacting health and disease states? And I would say within the last 5 years or so, these technologies, they used to be just in research institutions and labs, but now they're being readily available to the masses where we could start using it for health optimization.
Awesome. Okay, well, we're now that we're talking about health optimization, let's talk about mitochondria. Mitochondria, for those of you who don't know what they are, and I'm a biology professor, so I have to bring it down to that level. They are an organelle inside of your cells. So there's still lots of organelles that are in there. They just kind of all work together. Think of it like a factory. They're different machines doing different things inside your cell. This one particularly produces energy. And it converts the energy that you get from food when you eat food into something known as ATP. This ATP, they call it the energy currency of the cell, very important for energy production. So if your ATP is not optimized or you're sluggish, you're going to feel it. You're going to have symptoms like brain fog and fatigue, energy deficits, and then infertility is one of those side effects. I will say, I always look at my 9-month-old. I'm like, man, he is producing a ton of ATP because this kid does not stop moving. I wish I could harness his ATP. So that's those of you, because there are going to be a lot of newbies that are on here who just don't know what we're talking about. So we're just going to try to break this down into layman's terms. So now that you know what ATP is and you know what mitochondria are, Greg's going to talk to us about what are some of the signs that your mitochondria aren't functioning? I named some of them. Can you name some more?
Yeah, I heard an interesting stat probably about, I don't know, 6 or 7 years ago. So on our cellular membrane, so we are electrical beings. We have electricity that flows through us that allows us to do things. And that electricity is through chemical gradients of different anions and cations like calcium and magnesium and potassium fluxing in and out of cells. And roughly like 75% of all our ATP that we use is used to do those fluxes in and out of cells. I've kind of changed the way I've thought about ATP from this purely mitochondrial phenomenon to this downstream phenomenon where it really impacts electrolyte balance and if our ATP production is off because our mitochondria is off, so will our electrolyte balance. And we've had the rise of things like AFib and dysautonomias, and so we're seeing this kind of downstream effect of mitochondrial dysfunction that is impacting these other facets of health. But yes, as you already mentioned, we mainly think of the mitochondria. So the mitochondria has its own genome, a lot smaller than our nuclear genome, the nucleus. But it does lots of different things in the body, one of which is generating energy, generating ATP. Connecting this with the metabolomics, we can uh, survey this by looking at different metabolites as part of the TCA cycle, which, this goes back to, your nutritional biochemistry class, looking at fumaric acid and oxalic acid, all those fun things. What we could also look at is metabolites so to make ATP, we need adenosine and we need adenine, and sometimes those are not being added properly to the ATP molecule. So we could measure those metabolites and infer mitochondrial dysfunction if we say those metabolites are dysfunctional. So there's lots of different ways that we could assess mitochondrial dysfunction, but from a metabolomics perspective, we're looking at certain key metabolites. Um, Obviously, this impacts fertility greatly. Roughly, each sperm has 50 to 75 mitochondria in each sperm. This is used to mainly for motile forces, so it could swim to where it needs to go. And then each human oocyte has anywhere from 100,000 to 600,000 mitochondria. So that is a very, very mitochondrial dense organelle or cell. And if we have mitochondrial dysfunction, it is going to severely affect the egg quality. So this is one reason why we really need to focus on this when we're talking about fertility.
And so when the cell divides, could the mitochondrial dysfunction affect the division and cause the aneuploidy and the non-disjunction? Could that be one of the root causes of it?
Yeah, absolutely. Because when a cell divides, a lot of those malfunctional mitochondria. So, there's something called mitophagy where we're going to be clearing these dysfunctional mitochondria. So let's say we're not doing that, which is type of aging, is this accumulation of these damaged organelles. They will go into these new cells, and so these new cells, even though they divided, we're seeing these damaged mitochondria. What will happen is if you accumulate a lot of damaged mitochondria, you could form this thing called a senescence. And there's these senescence phenotypes where you generate these low-grade inflammation. So it's not just about the mitochondria malfunctioning. Now we're going into the inflammation piece, which is another confounding factor that will also further inhibit the mitochondrial function ATP generation. So absolutely, we definitely don't want mitochondrial dysfunction because it's going to affect cell division negatively.
All right. So let's dive into the Theriome test. So how does this make it different than other functional tests on the market, in your opinion?
Sure. So for something to be truly metabolomics, it has to be looking at the some inferences to what the entire metabolome is, and then making health predictions from that. So let's say you go to your doctor, you get a CMP. You're looking at certain either proteins or metabolites, and so that's not true proteomics or metabolomics because it's not making some health calculation overall. It's just looking at like, oh, your AST is high, that could be liver, and it's just like one marker for one thing. Metabolomics, to truly do metabolomics, there has to be some type of analysis or algorithm that is looking at groupings of metabolites and making assumptions for health and disease states. So I already mentioned some of these metabolites. We talked about TCA cycle metabolites or these purine metabolites such as adenosine and adenine. What you would need to do is use artificial intelligence and machine learning to look at the trends in these metabolites and see how they can be affecting other health states, for example, cardiovascular health. If you have mitochondrial dysfunction, it could affect cardiovascular health or endocrine health. Now, you wouldn't just look at those metabolites. There are other metabolites that will specifically affect those things. So, a metabolomics approach is looking at these groupings of metabolites and then making characterizations. The Theriome test uses a calculation algorithm. And so for each one of our health domains, we'll do a scoring calculation. We have an overall health score that we do for people, 0 to 100. Most people fall between 40 to 70 range. And then we have the individual health domains. And so we have endocrine function, cardiovascular function, mitochondrial function. And so what we essentially do is we have 12 health domains, and how all those are scored will then affect the overall health score. That's part one of the Theriome test. Part two is what do we even do about it? And so because we're scoring things, we can run a simulation to see how we can affect those health scores by introducing different interventions. So we have a database of over 1,300 interventions, and what we do is we run a simulation. If we were to add this different dietary recommendation or supplement recommendation or lifestyle intervention or peptide or whatever it is, and to see how that would favorably impact the health score. And we do this thousands of times running the simulation. And then what we do is curate a protocol that's going to have the overall best combination of interventions that will have the most favorable impact on the health score. So rather than doing the trial and error of, okay, we have a couple of metabolites and we have a couple interventions and then hope that works, this way we do an overall holistic approach using AI. Okay, these are overall health scores. So rather than just hyper focusing on one metabolite, which a lot of practitioners like to do, let's look at it holistically, add a scoring algorithm, and then rather than do trial and error of a bunch of interventions, let's run a simulation and see what makes the most sense. And this way it takes the guesswork out of trying to figure out what to do. So that's the two main parts of the Theriome test is this AI metabolomic scoring system and then the digital twinning algorithm where it curates that protocol.
Oh, that's really cool. You mentioned TCA cycle metabolites, and just if you know this or not, because I know Chris Masterjohn just came up with a new test for the electron transport chain, and he was going through the metabolites of that. A very expensive test, by the way. Um, are you familiar with this one?
I have heard of it. I don't know exactly because I don't think they specifically even list what they're testing on their
Yeah,
website.
yeah. I don't. I'm not sure if he listed out the metabolites, but I'm just curious if the Therium also use the electron transport
I
chain.
think they're looking at like proton leaking, and if there's a lot of proton leaking, then that could be, I could be completely wrong, but that could be indicative of mitochondrial dysfunction. I did research way back in 2016. I was looking at studying mTOR and mitochondrial function. There's something called a seahorse assay where you could look at this mitochondrial dysfunction based on this protein gradient. So I think he's adapted that to being a test. Though that's not metabolites. And quite frankly, I mean, for the electron transport chain, you have your cytochromes, and then you have your ATP synthase. So it's not necessarily metabolites you could be testing in there. Uh, so that's going to be distinctly different from something like the Krebs cycle or even upstream metabolites. So the Theriome test doesn't just have TCAs. We have over 100 plus metabolites. We have upstream of that, we have glycolysis metabolites, which then feeds into the TCA cycle. We have fatty acids, which can feed into the TCA cycle, various different amino acids that feed into the TCA cycle. So I would say it's a completely different approach. I'd be curious how they would help each other. I would, and I think we are kind of, I think we may be having conversations regarding looking at that test and how it is matching up with our test, but let's say that's to be determined as
Oh,
well.
that'd be great. That'd be really good. We'd like a one-stop shop if we can. All right, so let's keep going. Do you know what inspired the creation of Therion? Was there like a gap in the industry?
Yeah, so I would say, like I mentioned, these like metabolomics was mostly reserved for research institutions, and it wasn't something that was publicly available. And so the idea behind the metabolomics, which was the first test, is that Therium has a metabolomics test, and they also have a microbiomics test. We started with the metabolomics test, but it was a matter of making this type of technology available for practitioners that want to run this on patients. And then the digital twinning. This was originally created by Boeing for simulations for airplanes. And it was basically like without crashing an airplane and doing all that, let's run a simulation to see how things would be impacted. And then people started thinking, wait a minute, what if we transfer this to medicine? Because medicine, as you know, it's a lot of trial and error. That's why they call it the practice of medicine because it's a practice. And so rather than just doing a bunch of trial and error, what if we ran simulations to be a little more precise in the recommendations? And so that was kind of the adaptation. And the concept of digital twinning, we started to make this test in 2023. In April of this year, the Scientific American Journal published a article, and it said, "Your digital twin may be coming to you." And we thought we've been doing this for about a year and a half, so we were kind of like pioneers in that, and then we're starting to see other entities kind of copycat us. But yeah, it was an idea to take the trial and error out of these protocols. And honestly, it gets a bit complex when you're looking at hundreds of metabolites. It's hard to figure out where do I go? Where do I start? Even the most seasoned practitioners could get a bit confusing. So it's going to be a better objective way to figure out what to do with your patients rather than just kind of biasly looking at a couple of metabolites and then going with whatever dietary or supplement intervention you'd like. And so it's kind of objectifying medicine in a way.
Cool. That sounds awesome. All right. So, this is going to come up, so let's just say it. How does it compare to the organic acid test, Nutri-Eval, or blood tests that other fertility clinics may do? I don't think a lot of them are doing the oat, to be honest with you. I just don't think they are. But if you have a savvy doctor who's like, yeah, let's run a note on you, how does this compare? Because I'll get that question.
Sure. So I would say the OAT is a metabolite test. It's not metabolomics. Um, basically any test that's running metabolites, obviously it will vary based on the metabolites that they're looking at. And so, we like the metabolites that we're looking at. We've used human metabolite database in order to curate our metabolites, but every metabolite test can have its own grouping of metabolites. What is done with that information, that's another thing that will vary. And so we have our digital twin algorithm in order to curate that protocol. Um, no, to my knowledge, there's not another metabolite test on the market that has such a thing. So, there's a couple, and I mean, look, before I started working for Theriome, I would use these other metabolite tests, and there's a couple of blurbs at the bottom, paragraphs. They're basically the same for every test, but it's lists a couple of things, which is generally helpful. I think it's a good starting point. But it's certainly not a comprehensive algorithm. Let me also say, the digital twinning algorithm that we use, whenever someone does our test, they fill out an intake form with their health history, their previous health diagnoses, their current diet, their current supplement regimen, um, symptoms, and that is combined with the digital twinning information. So your digital twin is not just your metabolites, it's your previous health history and the metabolites. So that whole thing is what is being used for these simulations. So the digital twin, sometimes if someone's, let's say they're on mitochondrial support and we run the our test and we see that the mitochondrial health is good, the recommendation the digital twins will spit out will say, stay on this mitochondrial supplement. It seems like it's helping. On the flip side, if they're on a mitochondrial support and we see their mitochondrial health is low, the digital twin will say, hey, you might want to change mitochondrial supplements or change the dosing or change something because it's not working that well. So there's that. And then the other thing is the sample type. So most O tests I know are urine, some are blood, some are stool. I don't know if there's a hair metabolite test. Obviously, you could measure minerals and such. But so yeah, the sample type will vary too. We've tried different things. We've looked at blood. We've looked at plasma. What we found is that for what we're looking at, the Theriome test is a finger stick. And so it's whole blood analysis from a couple drops of blood. And we found that that's the most accurate way to assess the metabolites that we're looking at. So that's another thing unique to us.
So what kind of patterns, and I'm going to combine these two questions, patterns or dysfunctions, do you think Theriome will reveal that your traditional fertility doctor will miss? And now think in mind, what are they doing? They're usually doing AMH, hormones. They do once in a while look at inflammatory markers, thyroid. They'll do like different tests within the uterus to see if there's any inflammation present there. Okay, so that's traditional fertility. What does this do that's different? And then from that information, how can this test be used to build a fertility optimization plan, really?
Yeah, and look, I think those tests are still great. This test is not going to say don't do any of those other things. I think it's still good measuring hormones, especially thyroid hormone. Um, One thing, like for example, we measure an intracellular marker called cyclic AMP. This is used for metabolic processes in the body. If someone has sufficient thyroid hormone, it's going to bind to receptors and elicit a metabolic cascade through cyclic AMP, which then will elicit its effects. Um, So, and most conventional doctors, they'll measure TSH if you're lucky, let alone free T3, free T4. But how is it triggering intracellular processes? We'd have to look at cyclic AMP, and that's just one metabolite of our 100 plus that we look at. So mitochondrial dysfunction, you could gain, some, let's say someone does have overt thyroid dysfunction, you could infer that there's probably mitochondrial dysfunction occurring, but by doing the or looking at the metabolites included in the Theriome test, that is a more precise way to look at something like mitochondrial dysfunction. We also have an endocrine metabolism section on our test itself. So it's not just about hormones, but the metabolism of the hormones on the nuclear level. So, what things are affecting the gene transcription of something like androgens? So, we look at things like spermidine and biogenic amines, which can impact the upregulation of enzymes that would make these hormones. We could look at estrogen metabolism. So, we have various different fatty acids that would impact that. And then things that impact cellular health. We haven't said the A word yet, antioxidants. But that is another huge thing that impacts sperm and egg quality. So things like glutathione, ferulic acid. We look at myoinositol. This is another thing commonly recommended for fertility specialists, especially for things like PCOS and insulin dysregulation. We measure that metabolite on our test. And that one's it's I actually love looking at that because for both men and women, it's a very important metabolite. Even something like serotonin, which it's not so much that it's directly impacting health, but also sexual desire. So people with lower serotonin are less likely to even want to have sex. So even neurotransmitters we'll look at to see how that's impacting things from like a mood perspective.
Okay, good. So let's see. I'm trying to see if you do you have an example of someone with fertility that you might be able to just generally share about who was using the test to optimize fertility?
Yeah, so I looked in our database to see, so I could sort based on what people's main interests are. So I was looking at fertility. I found 5 examples, but they were all within the last 6 months. And another thing I'll add about this test is based on the score and the recommendations, the AI will calculate a time to retest. Sometimes it's as short as 3 months, sometimes it's as long as a year, depending on how long it takes to shift. But on average, I would say six months is the average. And so those 5 cases I saw, it was within the last 6 months. So none of them have actually retested. But I looked at them, and let's just say from a fertility perspective, there was a lot of things that were actionable that can be modified. Obviously, we were talking about mitochondrial health. Within our mitochondrial section, we look at lots of different things. So not just from the TCA cycle perspective, and there's key TCA cycle metabolites that we look at. Succinic acid is a big one. Um, Things like mycotoxins and heavy metals can also impact fertility. That's one thing you'll see. You'll see succinate elevated. And I saw that on a couple of people that their succinate was really high. Also, we do have a environmental health section where we could look at some of these things, heavy metals and mycotoxins. And I saw that that was elevated on some people as well. So making the connections between some environmental exposures and mitochondrial disruption. So I saw that on a couple people. We haven't talked about NAD. NAD declines as we get older. Things can zap us of NAD deficiency. Chronic viral infections will impact fertility. One thing you'll see with people with that is low niacinamide and nicotinic acid, which will be a proxy for NAD levels. So I also saw that on some people where that was being kind of tanked. Antioxidant status, glutathione, just because in Western part of the world we are bombarded with toxins, actually probably most of the world, but I will frequently see glutathione and its precursors, glycine, cysteine, and glutamine low on people. So I've also saw that. And these are part of the recommendations too, I will say, especially for people with fertility. I'll also see recommendations for things like liposomal glutathione and detox support. Also, this isn't a fertility case, but this was I didn't look this up. I had this patient. They ran this test. We were going over the results, but I didn't see them for several months. When I saw them, they revealed to me that they were pregnant, but they didn't know that at the time of the test. But the digital twinning suggested a signature that they needed to increase their phosphatidylcholine intake. And I thought that was so incredible because your PC requirements will go up as when you get pregnant. low phosphatidylcholine associated with a lot of not so good thing in general, but also with pregnancy outcomes. And I thought it was so interesting that the digital twinning was like, okay, whatever's going on in this metabolome, you need to increase your phosphatidylcholine intake. So I thought that was really cool. It was almost like, was this just a pregnancy test? Could we detect pregnancy by just looking at these metabolites or metabolites? So I thought that was a kind of interesting use case. And I told the director of metabolomics this. He's like, wow, it's really cool, but he's sort of not surprised because he knows the all the things that metabolomics can do. But yeah, you'll see some interesting things like that.
Pretty cool. Men, sperm health. Is that also beneficial for them? So when they're, let's just put it this way. When a husband and wife are trying to conceive, should they both take Theriome?
Yes, no, I would say absolutely. Well, okay, I would say simply from this perspective of when couples that get healthy together stay together, dieting and exercising together, it's just going to make everything better. I'm sure you've seen it too. When one person is trying to do something healthy and your other partner is not caring, it just makes it all the more challenging. But everyone has their own unique things. I've had couples where maybe one has more distinct mitochondrial dysfunction and maybe another one doesn't. We have one of our domains looks at parabens and phthalate exposure, looking at metabolites that will be impacted by that. And you'll see maybe one partner is using certain personal care products and those levels are going up, and then they're more likely at risk for endocrine dysfunction. So you'll see those kind of nuances between people, from a dysfunction perspective, from an environmental exposure perspective. Cardiovascular health, I found that men wind up scoring worse for whatever reason. So nitric oxide, endothelial function is another big issue there, which, that will affect your ability to maintain erections. So a lot of men start freaking out when they start thinking about that. So whatever gets them interested in it. But yes, it absolutely has lots of utility for both men and women.
Oh, so I'm sorry. Can you elaborate a little bit more on the nitric oxide and the tests here?
Sure. So we look at enos upregulators. So arginine is a precursor for nitric oxide. Also, we look at the urea cycle as well. So arginine is part of that. We also look at ornithine. Another thing I'll see is if there's poor ammonia clearance, you'll see arginine and ornithine off a little bit. But yeah, we could look at these precursors for nitric oxide and also antioxidant status as well. If someone, so you don't want nitric oxide, you don't want too much of that because it can be, it is an oxide radical. So you don't want to see nitric oxide impairment in conjunction with low antioxidant status. So for that, it's okay. Is their nitric oxide good, and do they have sufficient antioxidants to quench those oxide radicals? So there's two things that we'll look at.
Okay, good. That's a good one. Alrighty. So do you have a sample test real quick? We can just run through it.
Yeah, absolutely. So let me share this.
You can just do a quick overview. I know the podcast people won't be able to see this, but if you're on the podcast and you might want to go visit me on YouTube, because I will have this on YouTube as well.
Sure, and I'll try to be as descriptive as possible. So
Sure.
what we're looking at is we have a spider graph. For the men out there, you probably know what this is if you've been following the NFL, because you'll see like bench press and broad jump and all these things. But instead of those things, we have our health domains. So we have mitochondrial health, cardiovascular health, liver health, neurocognitive health, environmental toxins, mutational load. This is another important one for conception because we have things in our environment called mutagens that could be mutating our DNA. And if, especially if you have a high mutational load, this might be even warranting you waiting to get this down before trying to conceive because, you don't want to introduce DNA mutations in yourself, let alone, your would-be child. So we have the spider graph. We rank it from poor in red, normal in yellow, green is optimized. And so you'll see someone will, for each one of these domains, they'll be falling within that. Then we have this overall health score here out of 100. And then, so we have lines for their health scores. And then we have this dashed line. This is what the AI digital twinning algorithm is predicting. If they were to adhere to roughly anywhere from 60 to 80% of the recommendations, this is the expected improvement if they were to adhere to that. So that's the main results page. As we scroll through, each one of these health domains has its own page. And this is where you'll see the actual metabolites. So in some of them you've already heard me mention. We'll see glutathione, we'll see spermidine, here's caffeine, adenosine that I mentioned. And then all of these metabolites, they're housed under these subdomains. So in aging, we have redox balance, antioxidant defense. We have a couple of metabolites there. We have energy and core metabolic intermediates in aging. We have a couple of metabolites there. These were actually we published a study on this. We took old and young people. What's the difference in metabolites between those people, and that's how we derived this. And we recently published that. So these domains are based on published research. And then here's the overall score at the top here. So as we scroll through, I mean, so we have 83 total subdomains, and so that's what each subdomain is going to look like. Let me go to the mitochondrial section. So here's those ATP precursors, adenine and adenosine in the energy and signaling section. We also have here this oxidative stress marker, 2-hydroxybutyric acid. If this is elevated, you know that there's something in your environment that is kind of stressing it out, literally from an oxidative perspective. Some core TCA cycle intermediates we have here, fumarate, isocitrate, and succinic acid that I was mentioning before. Fatty acid oxidation, glycolysis. Here's that niacinamide that I mentioned is a precursor for NAD, and then this mitochondrial health signaling. So, and that's just our mitochondrial section. So yeah, we have these 12 health domains. There's just a lot to dive in here. Let me say that anyone that does this test, we do give a consult. And so we walk through this test with practitioners to try to figure out, okay, given the health concerns of your patient, what's the most important health domains that we want to focus on? What's the most important metabolites that we want to focus on? And so we'll go over that information. Actually, let me not skip over the endocrine section. Let me go back to that. So we look at metabolites associated with androgenic metabolism. I talked about those biogenic amines, how that could be affecting the upregulation of androgens. Estrogen metabolism, especially these fatty acids, believe it or not, these can be either estrogenic, pro or anti. So we're looking at these fatty acids here. And then metabolites that affect both. So I mentioned some of these already. Adenine, very high caffeine is not good for fertility, so we include that on the section as well. Here's that cyclic AMP I mentioned as a intracellular messaging molecule. If this is really low, that's not good. That could be indicative of poor thyroid signaling, or T3 signaling, I should say. Glutathione as the antioxidant. There's myoinositol. Putrescine, so this is that gut fermentation byproduct. If this is too high, could be indicative of gut dysfunction, furthering infertility. And here's serotonin, like I mentioned. And so, yeah, that's our endocrine section. And so from all these, what we will do is form, we also have methylation. We didn't
Oh,
talk.
mutational load. Can you go over that one real quick too? I
Sure.
saw.
So mutational load, we're looking at three key areas: oxidative stress. So here again, cyclic AMP, tyrosine, and then sucrose, which if you have very high glucose and that's not being metabolized well, it can be eventually converted to sucrose, which will increase oxidative stress. 3-methyladenine. I have a couple, well, I shouldn't say a couple. I have metabolites on this test that I find of great interest. This one, if it's high, will inhibit autophagy. So this will literally contribute to cellular aging. So if I see this on somebody, we know that their autophagy is possibly being inhibited. I mean, autophagy is an anti-aging mechanism, so that's not a good thing. And then DNA repair. These are basically all nucleotides, purine and pyrimidine nucleotides. And if we see these are elevated, it could indicate, or downregulated, it could indicate impairments in DNA repair. So, yeah, some of the things.
Impressive.
And then methylation. We didn't talk about methylation, MTHFR, things like methylated folate. If you're not methylating properly, you will not be able to conceive, or you're more likely to miscarry. So assessing for methylation is really important. And we have a methylation efficiency index, not created by us. This was created by cancer researchers that were particularly interested in targeting methylation pathways for cancer drugs, but not that we're using cancer drugs, but we're using the way that they assess methylation in our test. And
There's no
so
fig glue on here that they have on the
there is not fig glue on here.
okay.
We're not directly assessing folate per se.
Folate status. Okay.
Yep. But we do have methylonic acid, which I believe is on the oat.
Yeah.
Oat doesn't include amino acids, so I don't think it includes any of these other ones.
It's the thionine. I've seen that on the NutriVal, but yeah, not on the oat.
Yep.
Yeah, yeah.
Yeah, you'll reckon. I mean, some of these, likely if you've been running metabolite tests previously, you should recognize most of them. Although some of them, like for example, this 3-methyladenine, I had never seen this
Mm-mm.
before.
Me neither.
But the more you run
I
this,
don't think I've seen cyclic AMP on anything.
me neither. I've never seen that on anything either.
Yeah.
So yeah, I like that. I like that one as well. So, and then the other part of this test is the digital twinning. And so this is where, again, we run that simulation, curate this protocol. Here we have next steps in 6 months. You'll see each domain, the top recommendation in each domain in terms of what it is. So we have here 100 milligrams ubiquinol, take it with a fat-containing meal. It will reduce oxidative damage, improve mitochondrial bioenergetics, and it will address low redox and energy metabolite levels. So in each recommendation, it's telling you why it's being recommended. So you'll see that for each domain, and there's a lot to sink your teeth into. It's pretty balanced in terms of dietary recommendations, supplement recommendations, lifestyle recommendations. You'll see peptides on here. Sometimes you'll see over-the-counter medications, cognitive behavioral therapy things. It varies. But basically, if it's in here, that means that there was some study that showed that this intervention in a clinical trial was able to impact these either metabolites or domains or health areas. And so that's so you'll have and what I'll do in a consult with practitioners is kind of go through this, figure out, okay, what interventions would be the best to implement now for the patient, given their health concerns. And there's as I'm scrolling through here, we have calcium D-glutarate, cruciferous vegetables, glycine, taurine, ornithine. So we have amino acids, vitamin D. There's never a dearth of interventions that's listed. Let's put it that way.
It's personalized. That's what I love about it because so many people that I've talked to in this fertility world, they're DIYing it. And they're just taking stuff because they read it on the internet.
Exactly. Yeah. It's a very so this would be considered precision medicine. That's what this is. And so if this is precision medicine, that means that the counter approach is imprecise. So by just taking supplements and things that you heard elsewhere, you're being imprecise. Doesn't mean that doesn't work, but if you want to be precise in what you should do, using precision medicine tests like this would help you be a little more well precise in what you should do.
Great. Thank you for sharing that.
Yep, absolutely.
So last question for you. What is advice would you give someone who feels stuck in their fertility journey, even though they were told by their doctors that everything was normal?
Yeah, so roughly like 85 to 90% of all fertility cases are reversible. There are some rare genetic cases. I feel as though that's usually overstated. You have had people that look like they're in premature ovarian failure, or now it's considered premature ovarian insufficiency, where you think it's just this rare genetic thing and that's it for them, but then they do some stuff and now they're fertile. So I would say keep diving for the answers to try to figure out what is going on. And work with a practitioner that is trained in these things that can look at things holistically. I'm a fan of a team approach, so make sure that you have practitioners addressing various facets of health, working with a nutritionist, working with someone that could address your genetics, working with somebody that could address the metabolite testing. But continue to dive deeper. There's a lot of, especially now compared to even 10 years ago, let alone 5 years ago, the amount of things on the market that you could look at to investigate your health is just exploding. So, but just make sure you're working with somebody because this could kind of get overwhelming. It's kind of like stepping on a bridge and looking down. It could be a little overwhelming. So make sure you're working with somebody that you feel comfortable with to interpret this information. But know that there's lots you could do, and to always have the faith that you can shift the needle.
Yeah, I'm amazed by how many people try to DIY it in this, so which is not unnecessary when they could have just done the shorter cut. When I say shortcut, meaning you would have gotten to your goals a little bit quicker this way. So that was a great answer. So I'm going to ask you this last one. What's one common fertility myth you wish people understood differently?
I'll tell you, being an naturopathic doctor, also trained in genetics, I feel like the myth is how much genetics is responsible for things. I like to say I focus on genetics not because I think it's the problem, it's because I don't think it's the problem, but it'd be a baseless statement for me just to say that. So, we should account for genetics, but the nice thing about the metabolomics testing is it is the output of genetics and environment and lifestyle and exposure, so it's more accurate than just doing, let's say, an MTHFR test. The metabolome is actually telling you what's going on now. So, I would say people that put such a heavy emphasis on the genetics, I think that's kind of a fallacy. It's important, but I would also consider these other things that are going on as well, especially for more, because you may have a genetic risk, but it's not manifesting. So the only way you would really know that is if you were to do something like a metabolomics test that would reveal how your metabolome is shifting. So I would de-emphasize genetics, even though it is still important, and I would emphasize all the other health areas.
Right. So there's only one test you can do for your fertility, maybe like budget, this is the one. That's how I
I
look at
would
it.
go with the
Absolutely.
metabolite test, metabolomics test. Yep.
Great. Well, thank you. This was great. I appreciate your time, and we'll looking forward to putting this up on our podcast and generating some fertility interest for you guys, for me too.
Absolutely.
All right. Thank you
Um,
so much.
Absolutely, Manny. You take care.